that is in the healthcare system. In home care, women are perhaps the most precariously employed of anywhere in the healthcare system. And in the trend in the early 1990s, late 1980s, early 1990s was actually to try and kind of systematize the healthcare system, try and create a long-term care system that's in nursing homes, etc., try and create a home care system. And the idea then was that it would be a public service, that those things would be created in the public not-for-profit realm. But following that in the mid 1990s, they brought in a system of competitive bidding, or a market-style system within home care. And this is a threat actually all across the public sector, and it's one of the ways that they use to sort of dampen down wages and working conditions in the public sector. And why this matters? Well, because the public sector is actually a huge employer of women in Canada, and is one of the places where women can achieve the most equity in wages in the country also. And so when you bring in these systems that actually try to dampen pressure on wages and working conditions for women, ultimately you increase the disparity between women's earnings and men's earnings. Well, home care is a workforce dominated overwhelmingly by women. And when it comes to personal support workers, overwhelmingly by women of color. And in this particular workforce, they brought in a system of competitive bidding, replacing the Victorian Order of Nurses, the Red Cross. You'll remember that here, particularly, I think, with the Red Cross, and other not-for-profits, with a bidding system that ushered in the for-profits to bid against the not-for-profits. And although every government for 20 years now has said, well, for more than 10 years now, has said that the bids are rated on quality, not on cost. The truth is that you can't really measure quality when it happens between a worker and a person in someone's private home. In fact, what they did was assess paper bids made by companies, and in a lot of cases companies that didn't even exist in the community prior to them bidding for the service. Companies that aim to hire 100% of the workers laid off from the companies that lost the contracts in the first place. And so this system was used primarily, despite all of the rhetoric about it, really was used to ensure that that workforce wouldn't increase their wages and working conditions substantially, as they would have probably if they had become a public service. And so in the beginning every year, then it became every 3 years, bids went out, home care nursing contracts and personal support contracts were put out to tender. If your company unionized, generally, if you negotiated better wages and working conditions, the price was higher for you, therefore your company lost the bids. And home care was de-unionized, and it was also destabilized. The majority of workers in the for-profits, in fact all the workers in the for-profits, are casual, what they call elect to work. It's a euphemism for casualized workforce. And in some of the not-for-profits started copying that system in order to be able to compete with the for-profits for contracts. At the end of the day, workers in home care earn about $10 an hour or more less than their counterparts in long-term care facilities, and less even still than their counterparts in hospitals. And this primarily women workforce, primarily women of color workforce for the support workers, has been targeted as one where healthcare costs will be kept down, really at the expense of the workforce. When these types of market mechanisms are brought into the public service, they have an extreme impact on women's ability to earn a living that they need. And one of the studies that was done during the SARS crisis found that the vast majority of home care workers had to work 2 or more jobs in order to cobble together a living as a result of these types of casualized working conditions, something that, of course, from a point of view of trying to contain the spread of a virus is a dangerous thing. But I raise that in particular because I think we're seeing at the city level at the provincial level and at the national level, a real attack on public services, and this kind of idea that it's a good thing to reduce the costs of the public service workforce without really thinking about how the public service workforce actually provides sustenance for families all across the country, how it's one of the places where women actually dominate the workforce in larger numbers than men do, and it's one of the places where women can actually earn a decent living, and that's crucial for all of our communities. I'd love to see the study that shows the value of the public sector workforce's pay to the rest of the community, and how the sort of spin-off effect of that, although I don't really believe that one should have to justify everything in purely monetary terms, it's also just and right that people earn a decent living.